Good to see you. I'm happy to see you today. I'm Miss Tally, and today we're going to start off by figuring out what we're going to talk about today. What this means is that we'll be setting the agenda. At the beginning of every session, we will do this so we can utilize time wisely to cover what is important. I have here a list of things that we'll discuss, and then there will be a part where I'll ask you if you'd like to add anything else. Does this sound okay?
I guess so. This is a lot to take in.
I'm glad you made the first step. In receiving help. And if at any time I'm explaining things too fast, let me know and we'll recap. You were referred to me from your school psychologist, but we'll get to that in a minute. While meeting with me, I want you to know that this first session will be a little different from those in the future. These first few sessions is about getting to know one another a little better. I know this is a lot of information to take in, but we'll go slow. The first thing I'd like to cover is how you've been feeling recently. I'd also like to check in to see what's happened since the evaluation, as well as talk about your diagnosis. After we discuss each of these things, I'd like to set some goals. Are you okay with this?
I don't know. I don't really like talking to strangers. And setting up goals? What kind of goals will be setting up?
I see there's some hesitation. That's not an uncommon feeling. During our conversation and based on what you share, we can decide when we get to it what goals you'd like to set for yourself. Based on those goals, there could be a few changes to your day-to-day schedule. After we've covered everything, I'll ask for your feedback on how the session went. How does this sound?
I don't know. I guess it's okay.
Good, let's move on. Remember I mentioned there was a part where I'd ask if there would be anything else you'd like to add to your list?
Yes, you mentioned something like that earlier.
Yes, I did. At this time, is there anything you'd like to discuss today?
I want to get back to where I used to be. Where I used to be is just hard. I know if I try to go back to my old life with my friends, I can't hang out with them. All they do is get high. I just want to go out with new people who understand me.
I'm sorry to cut off your train of thought. How about if we add making new friends on the agenda and we'll see if we can get to it today?
I want to get back to where I used to be, who I used to be. It's just hard. I know if I try to go back to my old life with my friends, I can't hang out with them. And all they do is get high. Oh, I said that already.
That's okay.
My kids are distracted because they're ringing the bell.
That's okay. I'm sorry to cut off your train of thought. How about if we add making new friends on the agenda and we'll see if we can get to it today?
I guess that's okay. I'm not sure how to go about that. I'll have to start all over. I don't even remember how I made those friends. Now I have to start all over.
As you'll see, I'll write down things from time to time during our sessions. This will allow me to remember what needs to be discussed. I hear your frustration with starting all over. I made note of that so we can go back and discuss it later.
I don't think so.
If throughout our session you can think of anything important you'd like to discuss, we'll pause and write it down on the list. Moving on to the next part of things. Earlier I mentioned that I'd ask you about how you've been feeling. How have you been feeling this week? What I like to do with my clients is have them take a few minutes and fill out this form. Now, while I'm looking over this form, can you tell me in just a few sentences how you felt this week?
I don't know how to really say it, but I've been feeling very anxious and on edge and a little on the downside. I have this anxious habit where it becomes so hard for me to breathe.
Were you an anxious person before you started using drugs?
Yeah, I guess. I started smoking weed at first once in a while and then helped calm down. But then it became every day, and when that wouldn't work, I looked for something stronger.
I hear what you're saying, and we'll get more into that in a moment. I think it'd be best for you to come a little earlier to each session. When you arrive 10 to 15 minutes early, I'll have you fill out these forms like you just did. Does that sound like something you could do?
Yeah, I think so.
Moving on to the next part. Earlier I mentioned we could also discuss what has happened between your evaluation and now that would be important for me to know. What do you think is important for me to know?
Yeah, sure. I don't want anyone to get into trouble, but I feel anxious all the time. My dad has heavily drinking again, has been heavily drinking again, and I think there might be drugs involved. I try to hide it in my room when he comes home, but that doesn't work. Most of the time, he's out with his friends since he's been left off of work. When he's not, he gets angry and starts throwing things around the house.
Has he ever hurt you before?
No, he just gets really loud and angry, and it scares me. I used to get high to try and forget about my problems. I just want him to stop.
Is this something you would want my help with?
I know it's not normal, and I know it needs to be fixed, but I'm worried how he'll react when he finds out I've told someone what's been going on.
I'm looking at the clock now. Our time is coming to an end. I want to continue talking about this next time we speak. Is this something we can add to your list to discuss next week?
It stays between us, then we can talk about it next time.
I'm going to make a note here today and we'll refer back to it next week to see how your week was and if it's still something that's of concern to you.
Okay, I guess this can work.
Before we move on, is there anything else that has happened this week that I should know about as well?
Not that I can think of.
Now that we've discussed that, I'd like to talk about your diagnosis and what I found out during your evaluation. Can we discuss that for a moment? What I noticed during the evaluation is that you do have anxiety and depression. It is a real illness, and with cognitive behavioral therapy, also known as CBT, you can start to manage it.
How do you know this?
I know this is a difficult time for you, but it's based off of your symptoms in the diagnostic manual. This manual has a list of symptoms and mental health disorders listed inside.
You mentioned CBT would help with this? What is it?
CBT is actually very helpful in helping others like you overcome their anxiety and depression.
Not the only one who's like this? I thought it was just me.
There are other patients like yourself that come here with similar problems. It's definitely normal for you to think like that. How does finding out what your diagnosis is make you feel?
I don't feel crazy, and I definitely don't feel alone now that you said I'm not the only one out there. I didn't think it was a common thing.
I want you to know none of this is your fault. Your brain thinks in a negative way because of your depression. Someone with depression may feel alone and hopeless, almost as if the world is a bland and colorless place. During our sessions, we'll work together and help you see things more realistically and add a little light to your world. Does this make sense?
I think it does. I'll probably understand better once we work on it.
Great. Let's move on to what other symptoms you have. I noticed from your evaluation that your anxiety and depression has interfered with your sleep. If you're not sleeping very well, it seems like it's also affecting your motivation to get up and conquer the day. I remember you stated earlier that you just want to be how you used to be. As of recently, have you criticized yourself for this?
It happens every day. I get mad at myself because I'm stuck in this cycle, and I tell myself I'm not good enough anymore. Those thoughts usually keep me in bed late. I've been missing some school because of it.
Let me ask you a question. If you were to have had a bad case of the flu and were in bed all day, would you think you're not good enough?
No, because that's different.
This week, I want you to answer back your negative thoughts. If you say you're not good enough, you will answer with what?
I try to remind myself that I am good enough. I know it's going to be hard because my first negative thoughts goes into an endless amount of them.
Try to remind yourself to answer that negative thought with a positive thought when you start thinking like that. Would you like to write that down or me so you can remember that?
I can write it down.
Make sure you date the paper at the top. This will be called either your therapy homework or your action plan. Which one do you prefer?
I hate homework. So we can call it action plan.
All right, I like the sound of that. On the top of the paper, I want you to write down something that says, if I start thinking something negative about myself, I will remind myself that I have a condition called depression. This illness makes it harder for me to do things. After you write that down, I also want you to write down another reminder. This one will remind you that as you go through CBT, you will notice that things will get easier.
Okay.
Furthermore, before we finish for the day, let's discuss what you've been doing through this week.
I mentioned that I've been having a hard time attending school. I missed 2 days this week. I haven't fallen that behind, but being in class, I feel like I learned better, so that gives me the feeling I'm behind. Does that make sense? I'm afraid I'll miss something for a test. My dad's also been angry that I've missed a lot of my classes. He doesn't understand me of what I'm going through.
It does make sense. Now I'm going to ask you a question. I want you to be honest with me. Have you had thoughts of hurting yourself or others?
I'll be honest. When I first was detoxing and giving up my addictions, I wanted this pain to go away. Now I don't. I just want someone to understand me and help me. I just want a little support, like I'm not doing this alone.
From the sounds of it, you are feeling frustrated and overwhelmed.
I just want my parents to be there for me. I want to live in a clean environment.
I hear what you're saying. It sounds like there are a couple of problems. You are having a hard time attending school and staying caught up as well. And not having any motivation from the lack of sleep because you're anxious. Can you think of anything else that I may need to know?
I think I mentioned that I hide in my room because my dad's been angry and drinking a lot. I want to go out and do things, but my friends are always getting high. I know I can't do that anymore, so it's been hard trying to get out of the house away from my dad when he's upset.
I want you to write down your goals for this week. Can you do this for me?
I guess.
Okay, from what I've heard you mention, you want to attend school and keep up with the work and make new friends and go out with friends. I want you to write down these goals. Now that you've done that, do you have any other goals you'd like to set?
I can't think of any.
Well, a few suggestions could be finding a hobby or joining a school club or sports team.
That sounds like a good idea.
Now tell me, what would you like your life to be like as a result of treatment?
I'll have to skip. Well, I would like to be happy. I don't want to be sad anymore. I want to go out. I just want to have a different life.
That seems like a good plan. I know we've discussed quite a few things today, so before we continue, let's recap what we've covered so far. Earlier, we set the agenda, we talked about your diagnosis, and we have set some goals. Now we'll move on to how your thinking affects your mood. In the past couple of days, did you notice your mood change? How long did it take you to become aware of that your mood has changed?
There was one time that I can remember.
Can you tell me a little bit about it?
Yeah, I was sitting in class when a couple of my old friends from my group walked by. They walked by me and laughed. I wanted to be cool like them again. That I wanted to fit in. And now I'm an outcast.
When they said that, do you remember what went through your mind?
I remember I got upset and went to the bathroom to cry.
From what I'm hearing, you had thoughts of wanting to fit in, that you felt like an outcast. How did your thoughts make you feel?
thoughts made me feel sad.
How about we create a diagram? You just explained how your thoughts impacted your feelings. I think for the next time, we should add to your action plan to remind yourself to ask yourself, what is going on in my mind when I notice my mood getting worse? Write it down, and then we can assess your thoughts next week and see if they are all true or not, or if they're in the middle.
Okay, that doesn't sound too bad.
You'll notice that because of your depression, that your thoughts aren't always accurate. I want you to also write on your action plan that just because you think something doesn't mean it's true. You'll feel better once we work on how to look at situations in a realistic way.
I don't know how I feel about that.
We'll work on it more once we get to that step.
Well, okay.
You'll find that once you understand it, you'll get good at it soon.
Okay.
Our time for this week is about to be up. Before we leave, can you tell me what you think is important for you to remember for the week?
I guess I could remind myself that I'm not who I used to be. I don't need to rely on drugs. Anxiety and depression can't control me, and I will get through it.
Right. See right there, you turned everything into a positive. Why don't you also try and see if you can join an after-school activity? That'll encourage you to stay active and socialize with others outside of your comfort zone.
I feel like I can do it, but I know when I actually have to go into school and do it, I'll be nervous.
It's okay. Now, before we leave, let's go over the homework. I want to make sure it's something you can complete. This week, you'll answer back any negative thought. Write them down and come up with something positive to say in return. Is this something you'll remember to do?
I think so. I know it'll definitely be hard to get into a routine of doing it.
It won't take you long at all to complete it.
I know, it's just the remembering part.
Before we go, let's have you set a reminder in the morning on your phone so you can fill it out. Then again for the afternoon.
That could probably work. I'll set the reminder twice so I can look at it in the morning and afternoon.
Good. The more you do it, the better. Lastly, I have a little pamphlet of information on your diagnosis. I'd also like you to read this when you have a chance.
I think I'll read it on the car ride home. I want to know more about my diagnosis.
It'll take a few minutes to read. While you read it, make notes on the paper with what you agree or what you don't, and what you don't understand. We'll discuss it at the beginning of next week if you have any questions.
Okay.
There's something that we can do after each session. So before we leave, we'll have you talk about how you thought the session went. Or you can fill out the paper in the waiting room and I'll read it over. If there are any problems you mentioned on the sheet, we'll put it on the agenda for next session.
Okay.
Before we leave for today, how do you think the session went? Anything that you were bothered by or you thought I did wrong?
Not that I can think of. I think I was able to open up more than I expected.
You did well today. It was great seeing you, and I'll see you next week, and we'll go over your assignment.
Okay, see you next week. Hi, Melissa. I'm happy you made it to our first session. Do you have a topic in mind that you would like to talk about today? I will ask you, in every start of each session, if there's something in particular that you want to discuss that you find important to you. It's called setting the agenda. I have a few things I would like to go over with you today. I thought maybe you would like to add to the list. Is that okay with you?
Yes.
Generally, our first session will be the longest because we have a lot to cover with the basis of getting acquainted with one another. I would like to start by asking how you've been feeling and what led you to voluntarily seek counseling. We can talk about establishing specific goals afterwards. Does that sound okay?
I think it does.
Is there anything you would like to add?
I just broke up with my boyfriend of 2 years, and it's been really hard to understand why I can't stay in a relationship. I just feel so alone. I feel anxious when I'm around other people, and it's really scary for me.
Can I suggest something? Like adding to the agenda that you could work on finding activities to engage in social interaction?
At this point, I'm willing to listen to anything.
When you see me writing, I'm writing notes to gain ideas about the agenda that you can help me create.
Okay.
So, Melissa, how are things at the moment? I gave you some forms that I asked for you to fill out. I'd like to see them while you talk to me about your week.
Well, this week I've been feeling very lonely and like I'm unable for someone to love me. Like I think I'm meant to be by myself. I give up on relationships. I would rather stay than go out with my friends. Like, I don't want to bring them down with me. I really want to get better.
It's though as if you've been feeling really sad. It sounds like you put a lot of pressure on yourself to try and feel a little better. Is that correct? It's pretty normal to feel down after a breakup.
Yeah, I guess you're right.
So, to my understanding, you were referred by your primary care physician because you have been experiencing a social anxiety and depression. Can we talk about that?
It hasn't really gotten bad for me. It has really gotten bad for me these past few months.
How are things at the moment?
I don't really go out much because I have been feeling really bad and I don't really accept invites to go out with my friends. And so I'm mostly in the house. Especially now that I broke up with my boyfriend, I don't think my friends fully understand what I'm going through. Like being around others is so scary for me from time to time when I decide to go out with my friends. But when we arrived, I started to feel very nervous and anxious, and I just went to my car and went back home and told my friends I wasn't feeling very well.
Oh. So, from the evaluation, it's stated that you have a hard time going to work because of this feeling. I know I added.
Yeah, I haven't really been attending work. I just feel very anxious.
Okay, sounds like you've been dealing with your anxiety.
Yeah, my friends judge me, and I feel like my coworkers judge me sometimes. And even when they invite me to places, they don't know that I'll attend. I'm feeling very anxious.
Did you think of anything to add to the agenda? If you do, please let me know.
I can't think of anything right now, but I'll definitely let you know.
Okay, Melissa. In reading your evaluation, I see that you've been diagnosed with depression and social anxiety for about 6 months. When did you notice that you were feeling down and anxious?
Well, I recently moved out of my parents' home, and now I feel like I have no one around to help me out. I have never lived on my own prior to this move, so it's just a new adjustment for me. I'm feeling very anxious.
I see. Okay. The evaluation shows that you display symptoms of moderate to severe depression and anxiety. I want you to know that this is a common illness.
Oh, it's a real illness?
Yes. Well, this is why you are here. Do you understand your diagnosis?
No, not really. Can we go into detail a little bit?
So it often means that you experience sadness often, and that it prevents you from having productive or being productive or going to work, for example. You start perceiving the world and everything around you at a negative light. Therapy is used to help you see things and help you move to a positive lens. to help you help yourself. Think positive. Did I provide a clarity about your diagnosis?
I think so, yeah.
When it comes to depression, do you remember an incident or time you were really down on yourself?
Actually, I think I do. When I was in high school in the 9th grade, I began to miss school, and my parents were so disappointed. They were really angry with me, but I continued to cut class until I was unable to catch up and ended up dropping out. I felt like a failure, and my relationship with my parents has never been the same.
Can I interject for a moment? Sounds like your negative thoughts are derived from your teenage years. You mentioned a cascade of thoughts, disappointment, loneliness, feeling like a failure. I tell you what, I'm going to give you this form so that whenever you have a negative thought, you can write it down. That way we can discuss it during our sessions. You think you can do that?
I think I can. I've just been, feeling very ashamed and very lost. So I think this might help. Will this be an assignment I have to complete?
Yes. So this will be an assignment, okay?
Okay. I just want to be happy and be able to go to work and socialize with my friends and my coworkers and, not feel down anymore. I'm just really tired.
So the way CBT works is we go by the theory that your thoughts impact your feelings and your feelings influence your behavior. This therapy is used to help patients learn their core beliefs to find out what caused those negative thoughts. The CBT strategy is to help clients redevelop their negative thoughts to alternative positive way of thinking. My goal is to help you separate your thoughts and your feelings. For example, I feel sad describes a feeling. I am not worthy describes a thought. Does that help you get a clear understanding of what CBT is?
Yeah, I think so.
Well, Melissa, we can end this session and remember what goals we agreed to and your assignment.
Yes, I will complete the assignment for our session next week.
Remember, whenever you have something to add to the agenda list, please let me know and have a good week.
Okay, thank you. Bye.
Bye.